Well, the school year is well underway, and as students bring home books and assignments, they could also be bringing home germs.
Yeah, especially little kids. I caught up with a local pediatrician to get some tips on how to keep kids healthy and what to do if your child ends up with a bug. Little runny noses, raspy coughs, and tiny fingers in a constant rotation between the mouth and nose. Parents of little ones know the drill, especially when the weather gets cooler and school is back in session.
They're spending time inside more together in a classroom with 12 to 30 kids, and so the germs spread that way.
And if your kid is in school, it's not really a question of if they'll catch something, but when.
We can't put our kids in a bubble, and so I think it's really important for us to understand that kids are going to have colds during the fall and winter and spring.
Dr. Lisa Denike is a pediatrician at Kaiser Permanente and says children born during the COVID lockdown, so-called pandemic babies, may be more susceptible to viruses this season, including the flu, COVID, and RSV.
What we're seeing is their immune systems didn't have the experience that babies in prior years had had. So as we began to unmask, we're seeing more of the viruses circulating because of naive immune systems.
And if your kid is battling a bug, knowing when to keep them home from school is important.
If your child has a fever, they need to stay home. Once the fever resolves, without medication, it's fine for them to go back to school. If we kept every kid home that had a runny nose and a cough, they would never go to school.
During those sick days, Dr. Denike says make sure to pump the water, as dehydration can become dangerous in kids, and take them into the doctor if their fever gets too high, like in the 104-degree range. But overall, she says prevention is key, and a big part of keeping kids healthy starts at home.
Sleep and good nutrition is a good place to start. And also, this can be challenging in little ones, but teaching them to blow their nose or wipe their nose and wash or sanitize their hands afterwards.
Dr. Denike says last year she saw an increase in RSV, which causes high mucus production and can lead to hospitalization in infants especially.
We've also seen an uptick in croup, which is usually characterized by a sore throat and a barky cough, usually just for fun for parents. It's in the middle of the night.
And of course, staying up to date on current vaccinations can be key to staying healthy overall.
We do have an RSV immune globulin now that we can give to infants. We don't routinely give that to older children because in years past, the RSV virus wasn't as problematic for older children. Older children have bigger noses, they have bigger throats, they can clear a lot more of the mucus that infants can.
And just know that virus could actually be helping them in the long run.
Inevitably, your child is going to have viruses if they're in school. That's just how it works. And that's good for them, actually, in some capacity to have that immunity as they get older against those routine viruses.
Another tip from Dr. Denike, teach your child how to sneeze properly or cough properly, either into a tissue, into their arm, or even down their shirt to avoid spreading germs.
Okay, they'll like the down their shirt, I know. That will be fun. Well, medical experts say that October is also the ideal month to get your flu vaccine. Flu cases usually do begin to rise in November, and doctors are saying that the best way to be protected against the illness is to get your vaccine now. The United States saw its highest amount of flu-related child deaths since 2009 last winter. Everyone starting from age 6 months and older can get their vaccine.
It's really important. It's preventable. These are effective. They're safe. And again, it's a very serious illness. It can cause very severe illness, hospitalizations, and even death, and it does that every year.
Pharmacies, health departments, and even some grocery stores do administer the flu vaccine.